put your hands together.
Good morning, colleagues. Good morning, our partners from HipCity. We thank God for bringing on this morning to this very important training program. The Executive Director, HipCity, Mr. Basi, you and your team, and my colleagues from RUWASSA, good morning. If you recall, our partnership with HipCity stretched far beyond even the establishment of FCT-RUWASSA. We've been engaging ourselves even when we were at the department in Waterboard. And by the time the RUWASSA was established, that partnership grew some and the interaction improved. And recently we even signed agreement of collaboration and partnership with HipCity. And there are many things that we cannot learn within the four walls of the university or colleges. It's through these interactions, engaging one another. So by the time we develop our capacities, then we should now justify that development by making impact in those communities. It will show by engagement with other SDAs, the way we respond to activities, to assignments, to even calls, to even mails from other agencies, from our superiors, the way we respond. That will even tell how far we have gone in terms of having the capacity. Because if we don't, they will not be saying, RUWASSA, they don't have capacity to do this. They cannot even do this. They cannot even write letters. They cannot even engage the community. They can even not even access communities. So today, HipCity is giving its contribution in training us to improve our knowledge base. And in doing so, what are those indices, those factors we look at in terms of monitoring and evaluating those developments, whether positive or negative? What I mean by positive or negative? Positive, the improvements, the negative, the gaps. So we put them in figures, in quantities, and then we monitor and evaluate, and they will serve as performance indicators. How far have we gone? What are the gaps? And that will give you opportunity to even have the statistics. So that way, you are not monitoring and evaluating whatever you are dealing with. In this our case, mainly water, sanitation, and hygiene activities, interventions. How many are they? Are they functioning? What are the attributes? If it's a borehole, what are the characteristics? If it's sanitation, lack of it, what are the health effects? We even extend further to go to the health centers and clinics and get a report of the illnesses they diagnose. Are they water sanitation related, or directly or indirectly? So why can we come in? With these statistics, we can take it to solicit for funds from our partners, from our principals, from FCT, even budget. Sometimes even you can take it up to make a case and take it to national budget. So please, I encourage you, including myself, to pick one or two things, learn, so that we'll apply it, not just in our RUWASSA work, even in our daily lives. Thank you very much.
Thank you. So, may I now invite the Executive Director of HipCity Innovation Centre for his own remark. Please put your hands together.
FCT-RUWASSA, heads of departments, staff members of FCT-RUWASSA. It is always my pleasure to be in your midst. Like I've always said repeatedly, that FCT-RUWASSA is family. And when we talk about issues of water sanitation, it's something that affects all of us. As far as you're human and you're living, you cannot do without water. People say water is life. And water constitutes a large majority of our body system. And then also, if you must stay alive, therefore means that you will eat. And when you eat, that food will not remain in your system forever. It means that it will go out for you to stay alive. That means that issues of water, sanitation, and hygiene is very important to the life of an individual and in society. So like the ED have said so much, I don't want to overflow some of the things he has already said. This training is an offshoot of the partnership that we have enjoyed and that we currently have with FCT-RUWASSA. We pray that it will be one of many other collaboration and partnership that we would have, and that at the end of the day, the society will be better for it. And I also want to use this time to thank the ED who have always been like a friend and father figure. Sometimes we even chat casually on WhatsApp. And Madam Aisha have been there from day one. And then all the people from PPME have become my family and the family of HipCity Innovation Centre. So thank you very much. Today's training is for monitoring and evaluation, but to put it, take it back home, it's about knowledge management. We cannot plan if we don't know how to manage the knowledge that we generate or the knowledge that is available. This training would be facilitated by someone who is an expert in M&E, someone who have worked with the INGOs, and you know that for us in the NGO space, data is life.
Monitoring and evaluation and knowledge management, a framework for effective and efficient public service delivery. So, yes, I just wanted to get an insight of what everybody wanted to learn from the session, so it will guide me better on how best we would approach the slides. So as we can see, I hope those at the back can see, as we can see, there are three things that I have captured: data management, monitoring and evaluation, knowledge management. And as we can see, it's an arrow. Proper data management would lead to easy monitoring and evaluation, which would lead to competent knowledge management. And for some people, it is very easy to confuse data management with knowledge management, saying that both of them are quite similar. There is management in both of them. But the difference is, one is data, one is knowledge. According to Merriam-Webster, what is data? Data is information, factual information, that is used as a basis for reasoning, decisions, or calculations. For instance, saying that it seems like Abuja should have 100 million people. It's a form of data, but is it factual? Because if I tell my ED, for instance, now that, sir, Abuja has 100 million people, he would ask me, where did you get that data from? And I will have to back up that data that I've just presented to him with something factual. That, in a nutshell, encapsulates how data management flows into monitoring and evaluation, and it flows into knowledge management. Because I gave the ED data, he monitored that data and evaluated it by asking me where I got the data from. To now ensure effective knowledge management, I have to provide sources that back up that data. If not, it is just mere speculation. So there's a difference between having proper data to work with and working on speculation. And this is where data management comes into play. Simply, data management is the practice of collecting, organizing, protecting. Very important. Because we see agencies, especially government agencies, that collect data. You go into rural communities, data is collected via the use of forms, via the use of field-in reports, and once they are used, maybe the data is extrapolated, those forms are discarded in such a way that the data collected is not protected. So I can give an agency my phone number because they came to where I stay or where I work to collect my data, and I give them certain aspects of my data that are supposed to be private. And 2 days later, I am seeing that data on the street. So my data was collected, but it was not protected. So proper data management establishes that you collect, you organize, and you protect, then you store for strategic decision making. In the previous presentation, HipCity said we would need a minimum of 3.9 million toilets between now and 2025 for effective water and sanitation hygiene. Now, how do we make sure that we achieve that goal if we do not have proper data management to back up that project? And this is where data management techniques now come in. They involve various techniques such as data preparation, data pipelines, data catalogs, data warehouses, data governance, and data security. You can prepare the data, you catalog the data, you make sure it has existing pipelines. I'm very sure there are reporting pipelines in the organization that certain memos go from the ED's desk to the head of units and to whoever is the implementing officer. Outside that chain, nobody outside that chain has privilege to that data. That is data protection. Because some things are meant for certain eyes only. And if data is not protected, data is wasted. And when data is wasted, knowledge cannot be managed. Why is data management important? It's important because visibility, reliability, security, and scalability. If somebody walks into this hall now and says, and goes outside to report to the Honorable Minister, for instance, that RUWASSA is conducting a training for 200 people, the Honorable Minister would ask 200 people, in what location was that training conducted? And we say, oh, the RUWASSA boardroom, and probably he has prior knowledge of how big this place is, and he says it's not possible. That data is faulty, so it doesn't give proper visibility to what we are doing here, and in turn, it impugns on the reliability of that data, which means that whatever else data that will come out from the organization will be looked at in such a way that this is not trustworthy because they have a reputation for giving us data that is not reliable. And if your data is not visible, it's not reliable, it can't be secure. And if it's not secure, you can't scale it. So if you say you need 3.9 million toilets, how am I supposed to trust that data when you cannot even give us reliable data for certain small projects in the first place? Then data management is also important because we need data to make proper decisions. Decisions that are backed by hard, factual data. And it's also important because we need to comply with existing regulations.
My name is Danladi Umaru Katampe. I'm the head of department Planning, Partnership, Monitoring and Evaluation, PPME of FCT-RUWASSA. This training was very, very fruitful and very important. We enjoyed it, especially the resource person. He delivered the topics very well. We are really going to step the training down into our other staff that were not here, and then especially the usage of Google Drive, especially the Google Drive. It was very, very interesting, and we are really going to use it in our department.
Okay, my name is Mrs. Aisha Bakpet. I am the head of Sanitation Department of FCT-Rural Water Supply and Sanitation Agency. Yes, I want to appreciate HipCity for this capacity building. This is the first time we are receiving this kind of data management training in RUWASSA, although we have different departments that are saddled with that responsibility, but bringing us together as a team It's a very beautiful capacity building. Personally, I've learned a lot. I've learned how to manage data. I've learned how to conduct monitoring in the field, and also the indicators of what we need to do when we go for monitoring. I'm so excited. I think I've learned a lot today, and I believe it's going to help us in our directorate. When you go about our normal inspection, which we've been doing before, so this one is going to help us to know better what we are supposed to look out for. It's not new, but this one has added more knowledge to us.
Thank you, ma'am. So we had about 3 to 4 topics. Which of them do you find one interesting?